North Shore 104.9, Erica and Donnie in the morning. We're joined by Karen Gomes this morning from Home Health. Welcome.
Thank you. I love the opening music. It gets me going in the morning.
Very good.
Well, Erica, she's usually exercising during the music too. With the whole Zoom thing, you can kind of see it, you know.
Well, welcome to Erica and Donnie on North Shore 104.9 this morning, especially because today is the start of Nurses Week. So this is a perfect time, Karen, for you to join us from the Home Health Foundation.
Thank you. It's great being here. And, the start of Nurses Week happens to be Florence Nightingale's birthday. And so we celebrate that every year as well. Preeminent nurse really started the profession, and, a lot of it is relevant today. So.
It's amazing what nurses have been doing. Like I watching on the news, and you know what amazes me is they're cheering people coming out of the hospitals with the COVID. And I think the person coming out should be cheering them. And I agree, everybody should be cheering each other what they're doing. But just what all these nurses are doing, and then to cheer for their own patients, I think is pretty incredible.
Yeah, that really is just incredibly moving to see. We work in the community, so our nurses are spread out and they're not together on a unit the way you see in all of those great clips from hospitals. But we celebrate our nurses in a lot of different ways as well. And we started a kind of an inspirational every day. We announce how many of our patients have recovered from COVID and no longer needing home health services. And we celebrate that with a little music clip that we put on our website every day for our nurses to listen to.
Nice.
Awesome.
Yeah.
So
how is the COVID-19 pandemic changed the way that you guys are doing business? And
well, like everybody, it changed us a lot. For one thing, all of our support staff are pretty much remote. We do have a skeleton team every day in the office, and we rotate so that somebody's always there, because our clinicians still need to come in and pick up their supplies and receive support. So we're open for business. A lot of our caseload has shifted to patients who are infected with COVID, and as well, we see patients in their homes. Sometimes it's the household member who's ill as well, and so our staff, require a lot of personal protective equipment and training and support in order to be able to deliver that care safely. We've been very fortunate. We have very, very few of our staff that have been ill because of this pandemic. I think a lot of that goes to their own just knowledge base in preventing infection and providing safe practice, as well as having really good access to personal protective equipment.
Now, how many nurses do you have in the work with you?
We have over 300 clinicians out on the road every day between all of our agencies and service types. We do home health and hospice, as well as some personal care assistance as well.
That's a lot.
Yeah. We've got a great team.
Have you guys been using, Zoom or telemedicine or FaceTime?
Yes. Yeah, we have. We've been doing a little bit of everything. Thankfully, the government relaxed some of the restrictions that in the past had prevented us from using kind of common sense things like Skype. As well, we already had a pretty well-developed telemonitoring program where we put equipment into patients' homes and collect their vital signs data and interact with them. And we expanded that greatly because of COVID. We currently have almost 200 video units out in the field in patients' homes, and we're doing video visits with them to really supplement the work that we're doing and reduce the number of in-person visits that need to happen.
Now, how much of an area do you cover?
We cover from southern Maine, southern New Hampshire along the coast and into the interior, and then a good chunk of Massachusetts down to Boston.
I think you have a full day ahead of you every day.
Yeah. I know. So, Karen, what is your typical day like?
Well, the typical day of a nurse in the field. I don't think you want to know what my typical day is like.
I can't even imagine.
I know. So what are you guys going to be doing today and for Nurses Week?
Well, we've got a lot of nice surprises planned for the week. It's a little bit different than usual. Normally we would, shower people with food and we'd have lots of nice events in our offices, and we can't do that this year. But we keep in touch remotely. We'll be doing a number of raffles. We're giving people HelloFresh meal kits, which we thought was a nice idea. Take some of the stress out of needing to shop and cook when you get home. Additionally, we've asked all of our nurses to send in pictures of their graduation photos with their nursing caps, and we're going to post those on our internal website just for some fun. What else are we doing? We're sharing our staff stories with the community. We've got some really nice press planned in both the Boston Globe, where they celebrate nurses every year, as well as in some of our local papers. Our hospice chaplain has recorded a virtual blessing of the hands for our staff to watch during the week. So lots of kind of meaningful things, I think, for people, in this, time where people are under more stress than normal. Being a nurse is never the easiest job. It's a very rewarding job. And I think that, even in this time of great stress and really personal sacrifice, I don't think people are second guessing their choice of being a nurse, but we need to do everything we can to support them as they continue to do that work every day.
I remember one time I was on a flight, and I'll never forget this. And I was on a JetBlue flight on my way to Florida, and then somebody had some issues, and then they get on the thing and they say, if there's any, nurses or doctors, could you please ring your bell? And next to me, there was a doctor wearing a Tufts, jacket. And then I look at her and I go, right when they said, like, 4 nurses got up to help this young person. And then the doctor, I said, you're going to help? They're like, I'll help when they need me. But these nurses, she goes, he needs an IV because he's dehydrated. And this is what she said. I'll never forget it. They probably put in 20 IVs last night. The last time I put an IV in somebody was probably 15 years ago.
Yeah.
So she tried to let the nurses do their thing, and then she stepped up and just kind of helped out. But it's amazing how nurses they're always there when you need them. They just step right up no matter the situation. So thank you for that too also.
Oh, well, I really appreciate that. And, nursing is a great profession, and it's just amazing how many people who are nurses. Nurses are everywhere. And like you said, whenever something happens, you'd be walking down the street. And if somebody's in distress, there's always a nurse there. And we always drop what we're doing and do what we can to help.
My sister's a nurse. She just became a nurse practitioner. And
congratulations.
Been a nurse for 20-something years. We were just talking about it before you came on.
I know. That's fantastic.
In my friend group of my girls, like, they're all nurses and doctors. I'm the only one that's a crazy radio person.
Hey, you got to spice it up a little bit.
Exactly. But
How would you recommend to listen
no
to
sympathy.
I don't know.
Either. If I get a paper cut, they're like, really?
Well, you can just ask my kids about being the child of a nurse. They never got to go to the doctor. It's like, oh, suck it up. I'll throw a splint on it. Oh, no problem.
I get the sniffles and I drive to the hospital. Like, I both hypochondriacs like you wouldn't believe. And I always think it's over for me. Like, I got the will all set. I tell my wife everything. The plans are good. You're all set. She's like, you got a cold. Just relax. No. But last time I went in, I had diverticulitis. I left the show.
This is true.
I was in the show, and I instantly got a pain like the night before a little, and then right after the show, I drove to the hospital. I ended up there for 4 days.
And of course, this is like right at the beginning of the COVID pandemic. So like, Donnie, you're not allowed back for 2 weeks.
And now, but we got to wait because we're going to bring our nurses at the nurses station down at the Leahy, a big coffee day that we do on Friday when we're allowed to come back in.
Oh, they'll certainly appreciate that.
Karen, how would you recommend a listener to contact you for home care assistance? How would they go about that?
The easiest way is probably just to visit our website, homehealthfoundation.org.
Right.
Excellent. So again, we've been talking to Karen Gomes from the Home Health Foundation, especially today is Nurses Day. Any last words this morning before we wrap with you?
I just want to thank all of our nurses in Home Health Foundation and all the nurses in our area that have been working so hard to really be at the forefront of the pandemic and to make a real difference in people's lives.
I totally agree.
Thank you very much, Karen. This is Karen, and she is from Home Health Foundation. And have a great day and have a great Nurses Week.
Thanks, Erica and Donnie.
Our pleasure. Again, that's homehealthfoundation.org. You can check it out for more information. We got to get a check with Mark on today's forecast.